Have you experienced this? At home, your blood pressure is fine, but it seems that by the time you walk through the door of the clinic and go through the process of checking in and then waiting to be called to the back, something changes. Especially if you're like me, and the first stop is the scale. I'm usually trying to take off everything I can before I step on. It's when you get situated in the room and the nurse wraps the blood pressure cuff around your arm, suddenly the numbers shoot up. Is this high blood pressure or white coat syndrome? Let's find out. I'm Dr. Lee, and I want to be clear. White coat syndrome is real, but it's not an excuse to ignore high blood pressure. In this video, I'll explain what white coat high blood pressure is, how common it is, why those nervous spikes still matter, how we diagnose true high blood pressure versus a white coat effect. Finally, I'll share a true story of a young patient who learned the hard way why you shouldn't brush off high readings. White coat syndrome refers to blood pressure that's high in a healthcare setting, but normal at home or during your daily life. It's usually triggered by the anxiety of being in a medical environment. For example, worrying about what your blood pressure might be or feeling nervous about seeing the doctor. That anxiety causes a surge of stress hormone, like adrenaline, which can raise your heart rate and blood pressure temporarily. Essentially, your body has a fight or flight response to the environment, even if you don't feel or look anxious. Studies estimate that about 15 to 30% of patients with elevated blood pressure readings in the doctor's office actually have normal readings when checked outside the office. There's also the opposite situation, which is called masked hypertension or masked high blood pressure, where someone's blood pressure is normal at the doctor's, but high at home. This can affect up to 30% of adults with otherwise normal readings. In this instance, if you do not check your blood pressure at home, then you won't know the difference, which can be very dangerous. Some people assume that if their high blood pressure is just because of stress while at the doctor's office, then it doesn't count. That is nothing to worry about. For years, even many doctors believed white coat syndrome wouldn't cause harm the same as high blood pressure. However, with newer research, we now know that white coat syndrome is not completely harmless. For one thing, those intermittent spikes in blood pressure may still be causing some damage to your body. Studies have found that people with white coat syndrome can show early signs of high blood pressure-related organ damage, like changes in the heart and blood vessels, compared to those people with truly normal blood pressures. And then over time, repeated high pressures, even if only during doctor visits, puts extra strain on your heart, arteries, and other organs. It's not as dangerous as having high blood pressure all of the time, but it's riskier than having completely normal blood pressure. One medical review concluded that white coat syndrome carries a small but definite increase in the risk of heart attacks, strokes, and other heart-related events than people with blood pressure that is always normal. So it's not a free pass after all. Think of it as a warning sign. In one 10-year study, about 42% of patients with white coat hypertension went on to develop true sustained high blood pressure. So that nervous high blood pressure you have now could potentially become high blood pressure all the time if you're not careful. This is a big reason why we don't simply shrug it off. It needs to be monitored closely by your doctor and by you at home. When a patient's readings are high in the clinic, but we suspect they might be normal the rest of the time, we have tools to find out. Some doctors may prescribe an ambulatory blood pressure monitoring, or ABMP. Basically, you wear a portable blood pressure cuff and a small monitor for 24 hours, going about your normal routine, This device automatically takes your blood pressure at regular intervals, usually every 15 to 30 minutes during the day, and a bit less frequently at night. It gives us a detailed picture of what your blood pressure is over an entire day, at home, at work, during sleep, and so on. If your blood pressure is indeed much lower outside the doctor's office, ambulatory blood pressure monitoring can capture that, and is considered to be the gold standard to confirm if someone has white coat syndrome, because it helps us to avoid misdiagnosing someone with chronic high blood pressure when they're actually fine most of the time. Another approach is home blood pressure monitoring. Your doctor might ask you to check your blood pressure at home with a reliable blood pressure cuff. Typically, we advise measuring it twice a day, morning and evening, for about 7 days, and keeping a log of those readings. Be sure to do it under calm conditions, following proper technique, seated back, supported, feet on the floor, after at least 5 minutes of rest. If your home readings over that period are mostly normal, while your in-office readings are high, then that strongly suggests that you have white coat syndrome. Many physicians use a combination of the home monitoring and the ambulatory blood pressure monitoring to make a diagnosis. Now, what happens if it is confirmed as white coat syndrome or white coat high blood pressure? According to current guidelines, if your out-of-office blood pressure readings are normal, we generally recommend observation and some healthy lifestyle changes. Normally, you'll be asked to periodically recheck your blood pressure, either with another round of home readings or a repeat ambulatory blood pressure monitoring in the future, just to ensure it's not creeping up. If any other risk factors are present, or if there's any evidence of organ strain, your doctor might discuss more aggressive treatment. In summary, if you get a high reading at the doctor's office, don't just assume it's just nerves or stress. Talk to your doctor about confirming it. This information is invaluable. If it does turn out to be white coat syndrome, you'll know to stay vigilant with your monitoring and home of your blood pressures. And if it turns out your blood pressure is high at home too, then you and your doctor can tackle it head on. I'm going to share with you a story of a patient of mine who was a 25-year-old male that came into the office for a routine checkup. We discovered that his blood pressure at that moment was extremely high. His numbers were around 180 over 110, which is severely elevated. He was surprised and immediately said that he was just anxious. It's because I'm here. Like, I swear my blood pressure is normal at home, doc. I'm only 25. I'm good. I'm healthy. This is what he told me. He was convinced that it was just a stress response from being in the clinic. Given how high his readings were, I was very concerned. I urged him to take it seriously. His repeat blood pressure reading after 15 minutes was still the same. I asked him to monitor his blood pressure at home, offered to set him up with an ambulatory blood pressure monitor, and also educated him on some lifestyle changes to start right away. Unfortunately, like many young people, he was invincible and skeptical that he actually had a problem. He brushed off the high reading as a fluke and just went on with his life. But just a few weeks later, this young man ended up in the emergency room in a full-blown hypertensive emergency, which means that blood pressure was so high that it has caused organ damage. His blood pressure at the time was 200 over 120 and had overwhelmed his kidneys so that he ended up going into acute renal failure. He had to start on dialysis immediately. So this 25-year-old went from perfectly healthy in his mind to being on dialysis. I remember how shocked and distraught he and his family were. For me, it really drove home this lesson. Never ignore high blood pressure. even if you think it's just stress or temporary. If you get an unexpected high reading, take it seriously and investigate it. In this case, the damage for the high blood pressure had already started before he even saw me. High blood pressure can be sneaky, and no one is immune to its effects. So please, if you're ever in a similar situation, err on the side of caution. Work with your doctor to be sure your blood pressure is truly under control. Don't just rely on an occasional doctor's visit. Just consider getting a good home blood pressure monitor. If you've had borderline or high readings before, measure your blood pressure at home. As we mentioned, over a 7-day period, in the morning and then at night. Make sure that you actually log the results. Tracking your numbers will help to determine whether it is a one-time spike or whether it is a consistent pattern. And just be sure to bring this log in with you at your doctor's appointment so that you both can review it together. Another thing you might consider is to address stress and anxiety. If your doctor visits truly make you nervous, let your healthcare team know. Sometimes simply having the nurse give you a few minutes to relax in a quiet room with no cell phone use before rechecking your blood pressure can offset the white coat effect. Practice slow, deep breathing while your blood pressure is being taken. You can also try techniques like meditation at home to overall reduce your anxiety levels. The calmer you are, then the less likely your adrenaline will spike your pressure. If you check your blood pressure at home, make sure you're calm and at ease. Sit quietly for at least 5 minutes before measuring. Over time, as you get more comfortable with the process, the readings may improve. Keep up with your regular checkups. It can be very tempting to avoid the doctor if you're worried about getting a high reading. Personally, I've had patients cancel appointments for this very reason, but that strategy backfires. Instead, maintain your routine doctor visits so your progress can be monitored. Remember, high blood pressure is called the silent killer because it often has no symptoms. You wouldn't know if it's causing harm without those checkups. By staying engaged with your healthcare providers, you and your doctor can catch any change early and act on it. A healthy lifestyle and regular follow-ups are your best friends. If you've been telling yourself, oh, just white coat syndrome, I hope this video has convinced you to take action and to take those readings seriously. You only get one heart and one pair of kidneys. Taking care of them is worth a little effort right now. So don't be afraid of that blood pressure cuff. Embrace it as a useful tool and a source of knowledge about your health. Until next time, stay encouraged, get active, and take back control of your health. You will be amazed at what you can accomplish.